I'm really excited about how technology is going to change medicine, and I think the most important way it's going to change it is in the actual practice of medicine. It's in the way that doctors see patients and the way that patients experience healthcare. And that's where we're going to make really big changes in reduction in cost and increase in quality. And the example of that is, on the physician side, it's by having an electronic medical record where the doctor doesn't have to pull out a big old fat chart and rifle through it to find information, where all the information they need is right there. Their workflow is identified for them. And on the patient side, it's really enabling patients to be seen when and where they need it. So technology really helps with that, whether it's telehealth or scheduling or anything that allows the treatment to occur at the time the patient actually wants it. Well, I think it's like any industry, and I've been around for quite a while. I've had a 30-year career. So I think it is embracing other women, mentoring other women. It's something that I try to spend a fair amount of my time doing. I advise startups that are committed to women. I have 2 women CEOs of startups that I advise. And I think it's in just getting out there and getting stuff done, because that's what really moves any industry. And the more women can demonstrate their expertise and ability to do that, the better off we'll all be.
Yeah, I think it's a great question and a fun thing to think about. I really think we're at a point where we have access to so much data is one thing that we think about a lot at Flatiron Health and that we're excited about, that we actually have the opportunity to learn from the experience of every single patient. And I don't think that was true before. I think much of the innovation in genomics and in collecting data through routine clinical care is going to allow us to look at patient populations and say, what do we think is the best possible course of treatment or path forward for this specific patient that's in front of us? And I think this is the first time that we're really able to do that at scale. Yeah, I think it's so important that women, exactly as you said, mentor each other and really help each other through. I think when I look back on the moments that I felt very supported or I've been able to support others, some of it just comes down to giving people the confidence that they need to take the step they already know that they need to take. So I think often having a peer, whether that's a woman or not, or a mentor that you can go to and say, this is the next step that I want to take in my career, and have someone say, great, what are you going to do tomorrow to make that happen?
So thank you for having me. I think one of the things that technology helps us with right off the bat is access. So, the idea of coming into a hospital in a traditional manner is changing. We see many, many more programs on the ambulatory side. My job is really on ambulatory care. And so lots of things that we did in a hospital at one point, we no longer do in the hospital or need to do. So by leveraging technologies such as wearables or the ability to have televisits or to communicate via portals to patients, allows us to take care of a wider span of people outside of the traditional brick and mortar hospital that we might have. I've been very fortunate. I think I've had some terrific mentors along the way, some of which have been other great women and some of which have been really very strong men who I think have seen a clear road ahead. I think what they all have in terms of a common thread is that every day it's about raising the bar just a little bit. It's not that you can't be satisfied and feel accomplished in what you've done that day or to that point, but just a little bit every day to be better than you were the day before. And I think if you can set those kind of goals and be open to what's in front of you. Sometimes those opportunities are staring you right in the face. I think I owe a lot of my opportunities to when people ask me to do things, I say yes, even if I don't know what I'm getting myself into. I've learned tons along the way, and lots of doors have opened because of it.